Maricopa County Department of Public Health is often tracking some of the most serious conditions.
What we've seen over the last 5 to 6 years, including the years of COVID, is a dramatic increase in some of our sexually transmitted infections, but specifically syphilis.
Dr. Nelson Nicolasora has seen the rise in cases firsthand.
After I moved here in Phoenix in 2019, I saw this is a significant change.
And the population most affected right now are women and babies.
We've seen a larger increase among female adult cases as compared to males, and we know that that translates into an increased risk of congenital syphilis when those women are pregnant, and that is in fact what we have seen.
Cases of congenital syphilis happen when a baby is born with the infection after the mother passes it on during pregnancy. Arizona law requires testing for STIs and syphilis during the first prenatal doctor visit.
And it looks as if there has been a dramatic decline in access and uptake to prenatal care among pregnant women. We've also seen increasing numbers of women reporting drug use.
The number of babies born with syphilis doubled each year between 2016 and 2019, according to Arizona Department of Health Services.
Those babies have a very, very high fatality rate. Of about the 200 of them last year. Unfortunately, there were 21 that died.
And doctors use antibiotics to treat the infection. If you go without treatment, it can damage your brain, nerves, eyes, blood vessels, bones, and joints. Syphilis in pregnant women can cause miscarriage, stillbirth, and even infant death.
Yeah, so Alexis, this isn't a new STD or STI, so it should be easy to prevent, right?
Yeah, medical professionals, they all agree that using protection, reducing sexual partners, and getting tested for STIs are the best way to protect yourselves. And we do have more resources on our azfamily app and website. Reporting from the newsroom, Alexis Dominguez for Arizona's Family.